So I'm a zoological medicine veterinarian and a former public health veterinarian. And so what I've covered and worked on in my career has been it spans cockroaches to whales. Everything in between, including those naked, two-legged things called humans. So that's been my spectrum of coverage. But also one of the things that a few of us have touched on is that we are also stewards and expected to be the health professionals for the environment. So actually, if I were to characterize myself, I would consider myself an ecosystem health professional. And I suppose that's the reason why I'm here. Now, we heard a little bit about how medical schools probably don't cover training or exposure to animal health concepts and how to integrate and work with veterinarians. But as a veterinarian, if you're a veterinarian in the house, raise your hand. There's I see a few of them. See, veterinarians tend to come to these things. Raise your hand if you're a physician in the audience. Right. Nice, I'll say hello to you. Okay. But when we graduate veterinary school, all of us in this room have raised our hand and said we will protect animal health, relieve animal suffering, conserve animal resources, promote public health, and advance medical knowledge. That's not a multiple choice question when we say we're going to accomplish those things as veterinarians. So it's incumbent upon us to be a part of a community that's integrated and works interdisciplinarily. So I'm glad to see that all of us are here to speak on the importance of working together to advance animal, human, and environmental health. So it was covered well, so I'll just touch base and re-emphasize. In veterinary schools and the veterinary community, there were three areas that I guess I'll re-emphasize here. There are diseases we share, right? Some of them are nasty, and some of them you just don't want. Veterinarians are part of that because so many of those diseases in humans are of animal origin. So I'll just re-emphasize that. The second concept is comparative medicine. There are diseases that can be best studied in animals, and animals also have spontaneously occurring diseases that we study so that we learn how to deal best with them in humans. And the third one that I think is an emerging field, and I'm guessing, raise your hand if you're an animal lover. Only about two of you raised your hand there. But intuitively, you know that you like animals around you because they make you feel good, etc. But increasingly, we're finding that there is value in the human-animal bond, and that value includes health benefits by us having animals in our presence. So, what we're doing now is moving from the intuitive nature of that understanding to finding it, to studying that more rigorously.